Greg Pauls. I'm a physical therapist, chiropractor, and head instructor here at Ringside Rehab. Thank you for visiting our gym. We're going to put on some YouTube videos for you. Make sure you tune into our Facebook and YouTube accounts. Thank you.
Welcome to Ringside Rehab. I'm Nathan Palzer, and I'm a world champion.
Hello, my name is Matt Palzer, and I am a 4-time world champion in kickboxing and a 2-time national champion in boxing. Welcome to our gym. Let's go!
Greg Palzer from Ringside Rehab. Thank you for joining us. As with any fitness program, make sure you're clear with your doctors as far as the safety and that you can be able to do everything with your heart and every other function. If you feel any lightheadedness, soreness, or you need to stop, make sure you stop, take a rest, and then get some advice if you need so. Thank you. We constantly get emails at Ringside Rehab to ask us questions: chiropractic, physical therapy, sports, kickboxing, boxing, karate, and nature. And thank you for those. We've gotten probably about 600 or so emails, or at least 2, one from my cousin and one from my uncle, asking me a specific question. Let me read you a little bit of their email. Dear Greg, my favorite cousin, please do not read this on the air. Oh, don't tell my brother that I'm the favorite cousin of Robin. Okay? She said, my father, your uncle, would like to see some piriformis stretching in order to stretch out the sciatic area. It's a good question. A lot of people will come to me and they'll say, Sensei Greg, or they'll say, Greg, what's the deal with sciatic pain? What's the deal with piriformis syndrome? A lot of different concepts out there in physical therapy and chiropractic and in healthcare. Some say there is a piriformis syndrome where it comes with a piriformis muscle attaches from the sacrum, the trochanter head, and the hip. And then 30% of the people, the sciatic nerve will go under that, 30% it will go through it, and 30% above it, and there's a 10% variability in that nerve going through that muscle there. Other people believe that, and myself as well, believe that a lot of the piriformis syndrome is really a low back syndrome that's kind of amplified, meaning that the sensitivity of those spinal nerves is so sensitive, it triggers a response of the muscle, and that makes the muscle spasm. So whether you treat it from the sciatic nerve or the piriformis, or you treat it from the low back, what's to say? If I treat the one, it might just keep coming back. So I want to treat both. I use a shotgun approach. I try to hit all the nerve roots in the spine, going from the head down or from the tailbone up, and then I hit all the nerves and the muscles going to the extremities. So I always believe there's a segmental impairment with extension, meaning that it kind of constantly moves from there. That was a good question, Robin, who I'm your favorite cousin of, and favorite nephew of my Uncle Warren. A shout out to them. But thank you. Thank you for the question. I'm going to show you some stretching now. But usually in physical therapy, what we're going to do is we're going to heat the muscle. So whether you use heat, 15, 20 minutes on, you'll use friction massage. There's different things you can do. Elbow in the tissue, try to inflame it. Do a controlled inflammation on it. That's what massage is inflaming the tissue, but in a controlled way. And then stretching it out. But we're going to show you some stretches right now, okay? All right. In this position laying, make sure you have you checked out with your doctor. This is not specifically for any person, but you've already cleared with your doctor injuries. I can't speak specifically on a certain injury unless I assess you myself. Otherwise, you have to go to your doctor and see. But this might hold you over as long as there's no pain. If you're doing some of these stretches and it hurts, don't go as far. Okay? With my knees bent, I'm going to show you a couple things. The first thing I would do for most lumbar patients, not all, is called a pelvic tilt. So what we're doing is we're taking our pelvis and raising it forward and back. Almost like I'm picking my butt up, but my butt stays down. And that's the motion. So that lordosis, or the curve in the back, we're trying to stretch out. Okay? So we're going to do 10 of these, 2-3 seconds on and off. As I get stronger, I can bring those up to about 10 seconds where I hold it. I can exhale and tighten my stomach. So exhale and squeezing down my stomach in order to contract the muscle. Okay? The next one from here is a single knee to chest. I'm bringing it back. And I'll go for about 10 to 15 seconds at the most. Okay, in the beginning, I might do 2-3 seconds, switch, 2-3 seconds. And I'll do that for repetitions of 10. Okay? But as you get more flexible and as it gets less painful, then I'll go a little bit more. When you're stretching, it shouldn't hurt. It should go just to the edge of the pain and slightly off. Meaning I go to the pain and go slightly off, and that's where I want to feel a stretch. As long as it feels like it's loosening. If you don't feel loosening, you might go even a little bit less in the beginning since you're not used to it, okay? The next thing you could do is a double knee to chest. So I'm going to bring one knee up and then the other. So I'm using my hands to lift the knees in order to offload the back. If I was just to lift my knees like that, that's going to put a big back strain on a lot of people. So what you're trying to do is use the hand as a lever arm to kind of pull it back to stretch you, okay? 10 to 15 seconds. And then I would relax them down, okay? Next thing is a hamstring stretch. So I'm going to bring my hand behind my knee, pulling it back to where I feel a little bit of a stretch. As I get more flexible and this doesn't feel like it's stretching anymore, I can bring this leg straight. But for now, I'm trying to straighten the low back so I don't strain the low back. And slowly trying to bring it to extension. I want to keep the knee bent though. I don't want to try to straighten that leg and bring it back. I want to bend it towards my chest and then slowly straighten. So I'm stretching more the meat of the hamstring. Okay? I'll go about 10 to 15 seconds on that one, then relax. And I'll do the other side to make me balance. So whatever you do on one side, try to do on the other. Even though only if it's one side that's hurting, try to do both sides to make you more balanced. Okay? Relaxing. Now here's the Piriformis stretch. In this position, I'm bringing the one leg straight. I'm going to try it without pain now. So let's say I'm very sensitive and I can't do that as much. I might take the foot right next to the knee and then bring it over slowly, about 10 to 15 seconds. As I get more flexible and this doesn't stretch, I'm going to bring my foot to the other side. And I'm bringing it over, keeping the foot on the floor if you can, and bringing it over to here. So now I'm going to feel more of a stretch down the piriformis area. If this gets more flexible and I can't feel it as much, I might go in a different position where I'm bringing it this way. And now what I'm going to do is I'm going to grab the other leg to pull it back. So I'm using my right arm to push my knee down and then pull it back gently towards my head. Okay, that's putting a different torque on it and bringing it down. Okay, and make sure you do both sides the same and keep it balanced. Hope that was a helpful tip to you, and I'll see you next time. God bless.